Great.
Well, I was hoping I could give this talk muted, but obviously that's not going to work. Welcome everybody, and I am really pleased to be giving a talk on what I've called two taboos, even though in truth they are just the opposite. And that is the issue of sex and money and clients and therapists' resistance to talk about these two themes or issues. I'd like you to imagine that you're walking down the street. We'll forget that it's the time of COVID, and an acquaintance comes up to you, someone you haven't seen for about a year, not a close friend, an acquaintance. And they see you and they run up and they say, "Hey, how you doing? How are you feeling? How's your health?" And just think about for a half a minute, what's your reaction to that? Just how do you feel? Acquaintance comes up, sees you, greets you warmly and says, "Hey, how you doing? How's your health?" Just what's your reaction? What are your thoughts? What are your emotions? And if you want to jot down just a few words, that's up to you. Nobody's going to see these. Now I'd like you to imagine that another acquaintance of similar status, that is not a close friend, an acquaintance, haven't seen them in a year. This person comes up to you and says, "Hey, how much money did you make in the last 6 months? And when's the last time you had great sex?" Now, just think about your emotional reaction to that one. And just jot down a few words that describes how you're feeling, what your thoughts are on that. So when it comes to money, what does get in the way of clients talking about financial issues, money problems with their therapist? One is family of origin and cultural background. That in many families, family finances are not spoken about. It's seen as a very private issue, maybe between the parents, but even as we enter adulthood, pardon me, it's rare unless there are severe financial problems that the children would be included in this. Second significant factor is one of shame. To have financial problems or difficulties, particularly if the client frames it as a failure, that their business is failing or that they're failing to earn as much money as they or their family thinks that they should be earning, it could be very shaming. Similarly, overspending, not being able to manage finances, being an impulsive shopper, spender, also may create feelings of shame and distress that they want to avoid discussing in their sessions. Some people see it as not a topic for therapy. Most people think about anxiety, depression, relationship issues, work problems as legitimate. But money, no. A further aspect that may reduce the client's willingness to talk about it is the resistance to changing. They may see and recognize that they have a problem. They may even see it as legitimate to bring up in therapy, but feel that change would just be too difficult. They've struggled with this all their life, so why bring it up? Therapist is going to push me, not going to be able to do what they say, or I feel too embarrassed about it, and it'd just be too hard to change, so why bring it up? And another factor is the fear of judgment. Very often people are very self-critical, sit in judgment of either they're under or overspending. And it's very likely that family members and peers may have similar judgments and criticisms. So they may be very fearful of receiving your judgments or your criticisms and may project their own criticisms and judgments onto you. So these are some of the reasons, not the only reasons, that clients will not bring up issues around money. But when you think about it, it may well be matched by the therapist's resistance to bring up money. Many therapists have great difficulty in discussing financial issues and money with their clients. I can remember when I was on my internship in the United States and I was working for a nonprofit, an NGO, but clients still had to pay something. And the typical thing was that they paid the receptionist. But I asked to be in charge of the payment and issues around that so that I could overcome my own difficulties and discomfort in dealing with these kinds of issues. And I'm really glad that I did it because it brought up many issues for me. So one issue that gets in the way of therapists bringing it up is when the client starts talking about their problems imagined, the therapist says to themselves, you think you've got problems. So they imagine and are confronted with their own discomfort about their own lack of ability to manage their finances or deal with emotional issues around money. So one source of therapist resistance is an over-identification with the issue, but in a way that creates discomfort. Secondly, a lack of knowledge and skills. The therapist might say, I'm not a financial advisor. What do I know about money? I don't budget, and I can't help anybody else with it because I can't even do it myself. So they don't believe that they can be of help to the therapist, but the mistake there is the belief that this is about advice, when it's really exploring the emotional issues and the behaviors that go along with financial issues, whether overspending, underspending, emotional attitudes toward money. That is where the work lies. Our cultural norms in the West, as you probably have experienced just from the acquaintance question that I asked at the start of this, cultural norms are very limiting about talking about money. We see it as intrusive and invasive. And unless the client invites us in, most therapists are uncomfortable to go there. Another factor that will interfere with the therapist bringing up client issues is a theoretical belief, particularly if you come from a client-centered approach, is that the client chooses the topic, the areas of discussion. And if the client doesn't bring it up, it's hands off for you. That is, you don't bring it up. The trouble with that is the client may take it as it's not okay to bring up issues of money, financial issues. So that's a very tricky situation. I'd like you to just write down, again, you don't have to share this with anybody, when you think about discussing financial issues, emotional issues around money, finances, What are your hesitancies? What comes up for you when you think about bringing it up with a client who hasn't brought it up herself or himself? And just jot some of those down. When working as a therapist, here are some things to think about, things you might want to explore with your client, and perhaps beforehand with yourself. What are the client's attitudes, beliefs, emotions associated with money, with spending, with saving? What is the tradition? What is the cultural norm in the family of origin and in their current family? Do they reflect the client's issues around self-worth, via deprivation, indulgence, overcompensating, narcissism? So looking at issues around self-worth. Exploring with the client, are they able to meet their core physical, social, emotional needs from a financial perspective? And if they are in a relationship or in family, the same with their family. You have people that are millionaires, billionaires, who people discover on death were extremely wealthy and they lived in a boarding house. So this may reflect something about attitudes of self-worth, fears, anxieties about going broke, about not spending enough, about other people's demands on themselves, etc. Is it a control or a power issue? Is it the control and management of self and or others? Is their spending in control or out of control? Does that spread into other areas or reflect other areas of behavior and attitudes? So this in control, out of control. And finally, are their financial capabilities balanced with their needs, their wishes, and their income, and those of people around them, which may be parental support, their own family, their children, and so on. So remember, this is not about financial advice. It's looking at, like any other issue in therapy, the emotional and behavioral aspects to this. So how do you introduce this if the client doesn't? One is naturally, as it occurs. Do they pay on time? Do they ask for a discount, an extension of payment? And then from there, you can go on and explore, is this a typical problem? Is this unique? Is this because of COVID? How are you handling your finances because of COVID? When a parallel process comes up, for example, they may say something about, I waste so much time, or I can't manage my time. And again, you could say, so does this come up in other areas? How do you spend your money? Are you able to manage your money in a way that you're telling me you can't manage time? When they talk about conflicts, so they might say, I'm really torn between having a holiday or saving up for a new bicycle. And then I would raise, so does this come up often that when it comes to decisions about spending money, you often find yourself in conflict with yourself or with others? listening for hints. They may say something like, it's hard for me to be caring toward myself. And then you can ask, in what ways does that manifest? Are they impulsive? Are they restrictive? Okay, I'm going to leave time for questions at the end, so I'm going to now turn to the subject that I know that all of you are secretly really here for, and that's the SEX. Didn't even dare to say it. So, your clients may well have very real sexual issues that interfere with their life being as fulfilling as possible. And for the similar reasons as with money, are too fearful, ashamed to bring it up with you. So with clients' resistance, it's similar to money, or it may be, but maybe even more difficult because there are usually culturally stronger taboos against discussing sex. They may feel it's something very private. They may feel it's betraying their partner or family culture, and so they become protective, and they may not know what is acceptable to talk about. How in the world could I talk about if I had fantasies about young children, whether I acted on it or not? How could I bring that up with the way society judges me? Would I feel safe to explore this with you? And how would you as a therapist deal with that kind of issue? So it can be very confronting. And the therapist resistance, again, some of the issues may be similar to money, but there's also transference and countertransference issues. And that is the feelings that the client may have toward the therapist, that they're attracted to them, and conversely, the countertransference may be very uncomfortable and very difficult to talk about sexual feelings, sexual attitudes, sexual issues when it's an elephant in the room. And that's a very difficult situation, but it certainly comes up, and it's a natural process in some situations. Therapists may again feel that you don't have the knowledge or the skill to deal with sexual difficulties, and there may be some truth in that. However, it may be that the client is not so much seeking treatment about something, but just needs to air some feelings or attitudes or fears. Because of the therapist's discomfort in discussing sexual issues, they don't create what I call an invitational atmosphere that suggests to the client that it's very permissible to talk about sexual issues. I'm going to quote a therapist who says, well, not a direct quote. She says, I don't go fishing. It's up to the client what they bring up. And if they don't bring it up, I'm not going to bring it up. So you've got that client-centered approach. And on the other side, you've got the therapist that feels comfortable with and believes that if it's significant, it's worth taking the risk to bring it in. And I will give you a concrete example of this. I saw, this is many, many years ago, I saw a couple, and they were coming weekly for an hour and a half. And I would say by the third session, I noticed I kept saying to myself, whatever they're presenting here to me is not what they're coming for. I didn't have the therapeutic alliance. That is a belief on their part yet of fully trusting me that whatever interventions I made, that they really had a sense that I was on their side in trying to solve this issue or issues between them. And so it was too soon. But by the sixth session, they were nervous, they were edgy, and I thought, the trust is there, the therapeutic alliance is there, this is costing them money. So I said to them, for the last 2 or 3 sessions, I've had a sense that there's something that you two want to discuss, but have felt too uncomfortable to bring up. Is that right? And they both looked at each other, their heads went down, which suggests shame or embarrassment, and they nodded their heads slowly. Then she brought her head up, looked at her husband and said, and I love this, will you tell him or will I? And he kind of just peeks up and points, you. So she says, for years we've had a serious sexual problem. Now, had I not brought that up, I suspect that in time that they would have, because they'd already agreed that they were going to come and work on their issue. So I was pretty sure in time, but this just brought it up out into the open, gave permission, and they just were able to progress from there. So, things for you to think about in dealing with sexual issues are, again, same with money, but in the addition, what meaning does their sexual experience have for them in terms of self-esteem, anti-anxiety, reassurance, desirability, all of these kinds of issues. So you can explore what meaning does it have, and don't let them dismiss it because it always does. 2, what are their conflicts and anxieties around sexual issues? Do they carry some norms, some taboos that they're frightened about? Family or cultural issues? What are some of the issues and conflicts and anxieties there? Sexual experience, physical intimacy is a way of connecting more deeply to oneself and to others, or disconnecting from oneself and others. So that is another thing to explore. Now I'm going to tell you, in case you know them, forget sort of about norms, because they're just very general statements. You know, I don't know what the average income is for Australians. It's probably somewhere between 75 and 100,000, I guess, because very wealthy people can really pull that average up. But when a person is sitting in front of you, what difference does that average make? So sexual norms really don't tell us very much. Focus on the individual or the couple and what their needs, their wishes are. Keep in mind that good sex is the process of exploration of both yourself and a partner. Like learning to read, good sex takes time, and you have to learn the basics first. And some people assume that they've got it when in fact they don't. And it's very difficult sometimes for couples to talk about their differences and their wishes and their desires. In a couple that I worked with, as we got down toward the last 2 sessions, she said to him, and they've been together for 20 years, she said to him, and I loved how she said this, she said, by the way, I don't like oral sex. Well, he looked stunned and shocked. This is 20 years into it. He says, I don't either. I was doing it because I thought you liked it. This is 20 years. So some couples have a really difficult time talking about what they like, what they don't like. Now, the younger generation, it's probably easier because some of the taboo about this has been lifted. But again, because of pornography and its widespread use, they can get so much the wrong observation of what sex is supposed to be like. So, ways to introduce sex into therapy, again, the same as money, and the innocent question. So when they talk about how busy they are, for example, again, whether this is an individual or a couple, I could ask, and does that interfere with your physical intimacy, your sexual intimacy? When do you have time for it? How much of a priority do you make it? And that is just an innocent question that leads into it. Ask directly. If a couple is sitting in front of you, which one of you is most likely to initiate sex? Which one of you is more interested in sex? And this really can open up just that simple question, incredible dialogue between the couple. You can ask it, you can introduce it very gently. In my practice, I have noticed that people who come and see me sometimes have great difficulty in talking about particular subjects. Very often, but not exclusively, it's about money or sex or abuse. And they have a variety of very good reasons for finding it so difficult to talk about. But I just want you to know that if you would ever like to talk about it, maybe not even right now, it's absolutely okay to talk about anything that you want to hear. And then a final way, particularly useful with couples. This was came from Stan Tatkin, who was a keynote speaker at the APS, one of the APS clinical conferences. He's a world-renowned couple therapist. He calls this shooting down the middle. He's got couples sitting facing each other in the room, and they're probably having an argument. And in the middle of the argument, he will just look straight down the middle. He doesn't look at either of them. He just looks straight down the middle, doesn't look at either of them. In the middle of the argument, he'll say, and so did you have great sex this week? Or, and so did you have great sex on Saturday night? It has two powerful effects. One is because it's so off target, it has a shocking effect. And couples usually just stop the arguing dead in their tracks. And then if it's the first time that this topic has been introduced, it's a very good way to bring it up or otherwise. And so that can be useful, but that's really dependent, again, on having a very trusting therapeutic alliance. You can't do that in your first session unless this couple really trusts you very, very quickly. So I'm going to stop here. I'm going to invite you to go into your breakout rooms. And one of the reasons you may find a little bit of resistance in doing this. One of the reasons that I have devised the 3 questions or exercises is for you to begin to just talk about the issues of money and sex with your colleagues. And the focus is going to be on the client. So I'm not asking you to reveal anything about your own personal life, but you might just see what it's like to talk about this. And then when you come back in about 12 minutes, be happy to hear any questions, any comments, or anything that emerged from your breakout rooms, and we will finish on time at 6:30. So we should have about 13 minutes or so of questions and comments. So if you would go to your breakout rooms, and I really encourage you to join those for that experience.